The D.C. Health Department says the sick person traveled through Union Station and visited MedStar Urgent Care in Adams Morgan.
So that means we now have confirmed cases of this highly contagious virus across D.C. and Maryland, and many of you have questions about how it spreads. So Katie Lesso is here getting us some answers tonight. Katie, what did you learn?
Yeah, well, measles is definitely top of mind for many of us. One of the experts I spoke with tonight says an increase in measles cases should be a warning.
It's definitely concerning. Measles transmission in the United States is driven by a failure to vaccinate.
Dr. Amy Winter is an assistant professor of epidemiology and biostatistics. She says measles is extremely contagious.
A single measles case is thought to cause on average 12 to 18 secondary cases. And how this compares to something like seasonal influenza, in which one case might infect one or two secondary cases.
She and other doctors believe the best way to steer clear is to get vaccinated.
They're very, very effective, over 97% if you get both vaccines.
Dr. Alexandra Yance is a pediatric infectious diseases physician at Children's National Hospital. She says if you're getting yourself or your kids vaccinated now, it usually takes up to 14 days to be fully vaccinated. As of Tuesday night, her hospital hasn't seen any confirmed cases, but has had a few people show up with symptoms.
What are the symptoms you're looking for that kind of raise a red flag for you guys?
Typically, there's two phases to a measles illness. First is a fever and sort of non-specific symptoms, and then this bright red, angry rash pops up, usually starting on the face and the head and then slowly working its way down the body.
This isn't the first time we've seen an uptick in measles cases in the last few years.
In 2019, there was a very large outbreak that took place. In fact, there was 1,200 cases that were reported in the United States. We haven't seen as many cases as we saw in 2019 as of yet, but of course that 1,200 plus cases was for the whole entire year, and we're just into the first quarter of 2025.
But Winter says what is concerning is what this type of uptick usually means.
It's really kind of a canary in the coal mine. It gives you an indication of how strong our vaccination program is. So because it's the most transmissible, when vaccine rates start dropping, it's going to be the first one to have an outbreak.
Now, the best thing doctors say you can do is check with your physician. Make sure you receive 2 doses of the vaccine. The vaccine, she says, is what stops the transmission train.
All right, Katie, so let's talk about this. And this is really important here because people are showing up at doctors' offices and other facilities. If you are showing symptoms, that fever, that itchy rash, what should you do?
Well, number one, you want to make sure you isolate, and then you're going to want to contact your doctor. Don't just show up to the ER or urgent care. Make sure you're calling ahead first and letting them know. Again, going back to the fact that we know this virus is extremely contagious.
Yeah, I can imagine you'd be tempted to run to the ER when you're
sure
showing
would.
those signs, but again,
Not
stay
this
at
time.
home. Yeah, Katie, thank you so much. And if you have more questions about measles, jot down this number right here, 202-895-5599. Send us a text message and we will work to get you an answer. You can also send us a note on Instagram. When we meet you right here tomorrow night at 11 o'clock, we're going to be talking with an expert on infectious diseases about vaccines, how measles spread, and what you can do to protect your family.